Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below.
A few months ago, I was skating and I pulled something in my lower right back area, and then I was kind of on and off skating because it was hurting. Then I just let it rest, and I was able to skate for a few weeks. Then I just hurt it again a few weeks later.
So, what type of accident? How did you hurt your back?
The way I fell was I was trying to skate this rail, and the way I fell is I tried to go onto it, and I slipped out and landed on my butt.
Okay, both sides or one side?
Both sides.
Both sides. Okay. And how long has been going on now? Last accident?
Like 3 weeks.
3 weeks. Okay. So, can you describe your symptoms now? What kind of pain? How much pain do you experience?
It just hurts. Hurts whenever I try to run. So I just cannot run no matter what. And whenever I go up the stairs, it hurts a little.
How much pain from 0 to 10 at worst?
At worst, like 5 or 6.
5 and 6. And where do you feel it exactly?
The same exact spot.
It's just in the lower mid back. Yeah, on the right side more.
Yes.
Okay. So, how to aggravate the symptoms? You said running. What else?
Walking up and down the stairs.
The stairs. Okay.
Jumping.
Skateboarding. Have you had any treatment for your back?
Other than just taking Advil, but I didn't.
Okay. Any other symptoms you have? Okay. So I will have you stand up and actually do the motion that's aggravated. So we have like a kind of a step here. So we'll have you do a few steps. Is it going up or down?
Mostly going up.
Going upstairs? Okay.
Yeah.
So let's actually do a few steps and tell me how much pain with that. So I'll have you stand up.
Hurts a little bit when I raise my leg up.
How much?
3.
3. Let's do 10. Okay. Let's get the whole body. And let me know how much pain. And let me know if the pain gets worse, okay? Are you counting?
Yeah.
Oh, okay. You're not counting, we're gonna do 400, okay? How many are you doing? Okay. So, how much pain do you feel now?
I feel around 5 or 6.
Where?
Same exact spot, and around the last 3, it hurt when I was going back down.
So before it was when you go up, but now it's up and down.
Yes.
Okay. So we will use that as a testing. We'll do the treatment and we'll do 10 more to see how you respond to the treatment. Okay. So sit up for me. So you see the left side, this side is moved forward. Yes. Let's go back. Sit up again. That's a positive test for functional leg length discrepancy, which means one leg longer, but it's a false. It's from soft tissue. A lot of soft tissue restrictions in the back. Let's do it again just to view it. Now it's aligned. You see my thumb? They align. Sit up. And because he has restriction in the back, his pelvis is stuck backward. That causes one leg to be longer. And when that happens, you can get when that happens, usually the pelvis pushing on the vertebra upward, you start to have muscle spasm because his pain is, you complain of your pain around here. When this is stuck upward, it's compressed on this area, and with that, when he does a lot of motion, because that causes like a false leg length discrepancy. It's like your car out of alignment, so you're gonna have more pressure, more wear on one side than the other side. So I'm gonna work on releasing that to keep it aligned. Then we're gonna give him exercises after the treatment. Okay. Alright, you feel the tightness here? That's very tight. The fascia should move like this. This is normal fascia movement. Okay. Look at this.
Oh my gosh.
So that's a very restricted fascia. Fascia is like wrapped surrounding the entire body. It's like a Spider-Man suit. That's a superficial fascia. We have a deep layer. But when the fascia is tight, it's similar to wearing a t-shirt 2 to 3 sizes too small. So it compresses on everything, so limited the range of motion because it does not give room for the joint to move. You feel that? I'm gonna release it. Any pain, discomfort with that? Or something? You see the mobility now? Let's just release it. It's stuck here, it's not moving. I will release it now. You see the movement?
Yeah.
And here. Sorry, make sure you say something, okay? And here, let's tight. Okay. So you like skating?
Yes.
So how long you been skating?
I've been taking it seriously for like 2 years now.
2 years? Wow, yeah. You really like it, yeah?
Yes.
How many days do you skate per week?
Like every day.
That's it?
Yeah.
Okay, how many hours a day?
Like at the least like 5 maybe.
Wow. Man, he's part-time skier.
Yeah, it's intense.
Wow.
That's why we're here.
Do you wear a helmet?
Yes.
You have to.
Yeah.
Does he wear anything else to protect his body?
Pants.
Oh, I'm glad you're wearing pants,
Yeah.
okay? Make sure you wear pants or shorts when you go outside, okay? Yeah, make sure you wear your helmet, okay?
Yeah.
I'm gonna work on the scar tissue. You feel this bump here?
Yeah.
That's a scar tissue. Oh, do you want to feel it? Do you?
Yeah.
Okay. So, tickles? Well,
Yeah.
it's fun to be here, you know? So, let's feel this. Just hold it here while I'm holding it, okay? You feel how nice and smooth here?
Yeah.
Okay, compared to this. You feel this bump here?
I do.
Yeah. So, can you tell the difference between the area that has a scar tissue
Yes.
and no scar tissue? You can speak loud, yeah?
Yes, I
Yeah.
can.
So,
Oh my
can you
God.
describe what you're feeling here?
It feels like bumps, little bumps.
Like marbles or
Yeah.
like rock here?
Yeah.
And how does it feel?
Nothing. Smooth.
Is that nice
Yeah.
and smooth?
Smooth.
So that's that's one of the way to know the scar tissue. Can you feel it?
Yeah.
Do you want to feel it with the tool?
Nah.
Okay. You already feel the scar, the marble.
It's a lot.
It's tickling a lot? Yeah. You see, you can get his face. It's fun, you know? Yeah. It's fun to be here. Yeah. You're not too bad, actually. I had like patient were like very loud, but
Well, he's a strong.
yeah.
He's,
That's good. So that's a scar tissue. So our muscle should act like a rubber band. When it's contract and relax, it does this. When you have a scar tissue, it's like you have a knot in the rubber band. So when the muscle contracts, it does not stretch, compress on nerve arteries, and it causes the muscle not lengthening enough. And that could cause like false like function, like Nancy discrepancy.
That makes so
Is
much
that too much here?
Kind of.
So he has a lot of like it's all soft tissue, as you see, you know. So with these tools, usually the expectation is the size of those marbles start to shrink until you get rid of it, and you know it start to have more like mobility. You can do it. Is that too much here?
No, it's just tickles.
Just tickles.
Yeah.
You know it's ticklish here.
Yes.
Okay. Is he very ticklish?
Yes, usually.
Okay. He's not too bad here. Yeah. That side is not too bad, but it's a little bit scartish. And back down. Oh, don't hit the wall. You see my thumb? There's no movement. It's they are aligned. It's the same line.
He's smiling.
Like back down.
Why are you smiling?
So
Does it feel
happy.
better?
It didn't hurt when I went up.
Yeah, it hurts. How much pain you felt when we did this test before?
Before, like 3.
3. You don't feel pain
Yeah,
now?
nothing.
Let's do it again. How's that?
Like a 1.
You feel it?
Like around a 1 or 2.
Where?
Kind of feels more towards the spine.
The spine? Okay.
Yeah.
Alright, so we'll get you some. Do you have water with you? Let's lie in back. This back, you can see him back. Yeah, this one.
Back.
This back.
Oh.
Yeah. Okay, is it okay to work on the stomach?
Yeah.
Okay. I am not trying to tickle him. I'm just assessing, okay? Because it's look like tickling.
Uncross your feet.
Okay. Is it painful? It's okay. Sorry. Okay. Is it more ticklish in the stomach or the back?
Probably back.
Okay. Make sure it's not painful, okay? Sure. Do it again. Back down. So it look even now. Okay, how does the back feel?
Pretty good.
Mm-hmm. Okay, so let's have you stand up. You feel any pain? Last 2 times?
No.
Okay. So we're gonna do 10. And you tell me how you feel. His alignment is even now. Yeah, that's fine. So let's do 10, okay? And let me know if you feel any pain, okay? He has even the Skateboard magazine t-shirt.
Nothing. But kind of like the slightest bit, but like it doesn't. Like if like I kind of feel something, but it doesn't.
So it's not pain, you just feel a little bit tightness?
Yeah.
But no pain.
Yeah. No.
Oh wow, this is tight here. Let me know if you feel pain, okay?
Feels kind of like a
Sorry.
stinging.
What about,
Feels like a what?
Stinging kind of.
Stinging.
sorry, what about now?
Yeah. So.
Sorry, okay. There's nothing here, just pressure, okay? I'm not injecting you. What about here?
It's fine.
It's fine, okay. Okay. So I'm gonna show you actually the scar tissue here, and that redness should disappear in 10 minutes. You know, but it's not too bad here. I feel. Relax. Okay. Feel it in the others. Lift your head up. Relax. Let go. And sit up and do that motion that you said it was 2 out of 10.
Oh, it was down here.
Yeah. No,
It was getting up on the bench, wasn't it?
oh, it was in the bench?
Yeah.
Because you said this was fine. Okay.
Go from the floor. Stay on the floor. It's when you got up there before you went out.
Mm-hmm.
Getting up, no, but when I lean forward, like a 1.
Do me a favor. Strengthen your head up. Okay, and do that motion while you're sitting up nice and tall. You need to work on your fascia. That's not a good fascia. Did you feel it with that? Because you stabilize your back, we need to do some core stabilization. I don't want you to slash forward like that. Do it again. The right way, not the wrong way. Do you feel anything? Okay, we're gonna work on core stabilization. Any pain? Right, so what do you think about the treatment?
It was good.
Yeah, did you feel a difference?
Yeah.
You can treat your pain at home and get similar results as what you just seen in this video. Simply click the link on the screen to start our home treatment program and begin your journey of healing, or go to asterinstitute.com.